Good evening, everyone. My name is Aysia Veal, and today I'm presenting my capstone, which is predicting maternal mortality rates using socioeconomic, demographic, environmental, and health infrastructure indicators. So, the World Health Organization defines maternal mortality as the death of a woman during pregnancy, childbirth, or within 42 days of termination of pregnancy. To go further, every 2 minutes, a woman dies from pregnancy or childbirth complications, and every year, thousands of maternal deaths occur that are pretty preventable. While the world has committed to reducing these deaths, progress has stalled, and in some regions, it is actually reversing. So that begs the question, what if we could use machine learning to pinpoint the exact structural determinants that would get us back on course and help us achieve that goal? And what if we could predict maternal mortality more accurately and go beyond identifying the determinants to understanding them and the roles that they play on a global scale? That's exactly what my project aims to do. So starting with the roadmap, I'll walk you through it in 6 steps. So first, the problem and why it matters, then the data and key patterns. Following that, we'll have the modeling approach, then results and insights, and we're going to take those results a step further to do some forecasting, and finally, future outcomes and what this means in the real world. So, about 260,000 women died during and following pregnancy and childbirth in 2023, and about 92% of all those deaths occurred in low and lower middle income countries that year, and most of them could have been prevented. So, sub-Saharan Africa had about 70% of those deaths, and Southern Asia had 17%. Now, the Americas, Eastern Mediterranean, Europe, and Western Pacific regions had much smaller rates, and between 2000 and year 2023, Eastern Europe, Southern Asia, and Sub-Saharan Africa did have the highest reduction in maternal mortality, but it's still some work to be done. Now, the United Nations has set a sustainable development goal to reduce maternal mortality to 70 deaths per 100,000 births by year 2030. But our global average remains near 200, as you can see in the figure. So we're moving in the right direction, but we're moving a little slowly. Now, the issue with traditional maternal mortality research is that it's mostly descriptive. It'll tell us what happened, but not what will happen or why. And then maternal mortality isn't caused by one factor. It's a combination of economic, demographic, and environmental conditions. So the project is going to move beyond description to identify some of those structural drivers using machine learning. Now, before building any models, I had to harmonize the data from all across the globe. So to do this, I built a 20-year data set combining World Bank and World Health Organization data from over 180 countries. And that required a good bit of taming before it was ready for machine learning. Because maternal mortality rates vary so much between a country like Norway that would have a maternal mortality rate of 1 to 4 deaths, and then a country like South Sudan that had 692 to 1,223 deaths per 100,000 births in 2023. Those raw numbers would have overwhelmed the model's ability to learn and cause a lot of skewness. So we had to apply that log transformation to the maternal mortality rate, and that shifted the distribution from a cliff to more of a bell curve, and that helped us focus on the target variable and obtain the best results. Then I went on to handle the missing values using regional median imputation to preserve geographic patterns on the global data. Now, to go more in depth with the data exploration, one of the strongest correlations was maternal mortality rates and fertility. And in the context of maternal mortality, fertility refers to the frequency and risk factors of pregnancy. So factors that make fertility high risk are your maternal age at birth, usually if that's under 18 and over the age of 34, birth order if you have over 3 births, and then the interval or like the time span between births if it's under 24 months between births. Now, those factors all increase fertility rate and make it high risk, and higher fertility is strongly associated with higher maternal mortality. GDP per capita shows the opposite. So that indicates higher income levels are linked to lower mortality. And then we have some environmental factors like air pollution, which is the PM 2.5, that also shows some influence. Now, to ensure that the findings were both rigorous and reproducible, I developed a structured pipeline where I built a system designed to handle the complexities of global health indicators. So, because maternal mortality is complex and nonlinear, a simple regression wasn't enough. I needed to ensure the approach was pretty thorough. Starting with data pre-processing and feature engineering, I then implemented a time-based train test split using data prior to 2018 for training and then more recent years for testing. And this approach better reflects real world forecasting and helps prevent that data leakage. From there, I tested multiple models, including linear models, neural networks, and ensemble methods. And then I took it further to tune 3 of the models for additional rigor using some cross validation and grid search to ensure they generalize well. Then I use SHAP and permutation importance to interpret the model and not just predict. Now, after testing 11 different modeling approaches, I found that linear models like lasso ridge and linear regression couldn't capture that complex intersectionality of global health, so they performed the worst. And the best model was random forest due to its accuracy and reliability. Ensemble methods like random forest can account for those threshold effects where a small change in maybe GDP or fertility has a massive impact in one country, but a smaller impact in another. It achieved an R square of 0.84, and that explained about 84% of the variance in maternal mortality, and it also maintained a relatively low error even in the high risk regions. So this confirms that nonlinear models are better suited for global problems. Now, while the R square shows how well the model explained the variance, it didn't capture the magnitude of the prediction errors. So I had to use the mean absolute error and the root mean square error because they provided error in real world units and made it more interpretable for maternal mortality cases. So the RMSE was especially important because it penalized the larger errors, which is critical when modeling high risk countries with extreme mortality rates. And that R square, it'll tell us how well the model fits the data, but the RMSE told us how useful the model is in practice, and we're trying to put this into practice. Now, the random forest model isn't just statistically strong, it's visually reliable too. So while it had the R squared of 0.84, that told us that the model explains most of the variance, but this plot gives a clearer picture of how the model performed across individual observations. So each point represents a predicted value compared to the actual maternal mortality value, and that dashed diagonal line represents perfect predictions. Now, the closer the points are to this line, the more accurate the model is. And as you can see, most of the data points cluster closely around the diagonal line, especially in the low to moderate maternal mortality range, and that indicates that the model is performing well for the majority of countries in the data set. Excuse me. However, you do see greater dispersion at higher maternal mortality values, suggesting that the predictions become less precise in more extreme cases. This is expected though, since high maternal mortality rate observations are less frequent and more variable. But overall, the model demonstrates some strong predictive performance and with some relatively stable error patterns, and that does give us some confidence to go forward with forecasting. Now, to understand why the model works, I use SHAP and permutation importance. The feature importance tells us which variables the model needs most, while SHAP tells us how those variables actually change the outcome. Both methods confirm that fertility rate and GDP are the most important drivers. So SHAP shows us the direction. So that means the higher fertility drives higher risk, while higher GDP decreases it. Permutation importance confirms that if we remove or shuffle certain variables, the model's accuracy collapses due to the weight of those variables. This moves our analysis from prediction to some actionable insight because in global health, stakeholders need to know which levers to pull. So by using SHAP and permutation importance as a double validation process, we ensure that those insights aren't just statistical means and they give us even more confidence. Now, models are most powerful when they allow us to look into the future. So I use the random forest framework to simulate three different but realistic global paths. The results show that if we continue that business as usual mindset, like with the baseline, which starts here in the black, and then you gotta look, it'll go into the green down there. It's not good enough to reach the 2030 goals. So in scenario one, we had health investment, which included a 20% increase in health spending and 10% rise in skilled birth attendance, and that did lead to a decline. For scenario two, we're thinking of current and future global climate crises that we could face. So if we increase the current air pollution by 15% and then the heat index days by 20%, the climate stress slows the progress, and that's pretty much on par with the baseline for a slow decline. And then in scenario three, we have the development progress, and I address those root drivers identified in the SHAP analysis and well, in the permutation importance one too. And that's GDP and fertility, and we can see a big shift. So by growing all countries' budgets by maybe 2% annually, and then you couple it with some decline in fertility, that'll show the strongest long-term impact and the fastest decline. And that's the only scenario that'll meet that sustainable development goal by 2030. So predictive modeling definitely revealed that we need a multidimensional policy approach to meet global targets. And by forecasting and isolating variables, we can see which interventions actually move the needle. Now, the biggest takeaway is that maternal mortality isn't just a healthcare issue or health metric. It's an economic and structural issue, and it's a reflection of a country's economic, demographic, and environmental reality. So by addressing it, excuse me, it requires improving fertility outcomes, economic conditions, and access to care simultaneously. And that's a critical discussion when trying to shift from clinical fixes to systemic change. However, we must lead with ethics, and from an ethical standpoint, it's important that models like this are used to prioritize resources and not exclude high-risk populations. And while we need granular data to save lives, we must ensure that the use of public data sets respects community privacy. Now, we know there's tension between data-driven health and individual privacy, and it's common knowledge that in order to make these models truly accurate, we often rely on public data sets that aggregate deeply personal information. So that is a powerful tool for, say, public health, but it does carry the risk of de-anonymization if it's not handled with proper security protocols. For instance, while my model uses national level data, I plan to use some subnational data going forward. Um, and that does increase the risk of identifying some vulnerable communities. And we have to ensure that data is used for resource allocation and not for marginalization. So ultimately, ethical data science requires us to protect the privacy of the people we are trying to save. Now, for future work, there are a few directions this project can go. So first, we can identify some specific geographic hotspots where maternal mortality risk is the highest. This would allow policymakers to target interventions more precisely instead of applying broad one-size-fits-all strategies. Second, if we incorporate some real-time economic and environmental data, that could shift this model from static forecasting to something closer to maybe an early warning system. So that means instead of reacting to outcomes, we could proactively detect risk. Another important direction is going deeper into demographic factors, especially understanding how different population groups are affected and why. And finally, a major step is moving beyond correlation and into causal AI. While the project does identify key relationships, that causal AI would allow us to answer questions like, if we improve GDP or reduce fertility rates, how much will maternal mortality actually change? And that's critical for designing effective evidence-based policy interventions. So to conclude, the research shows that maternal mortality is not just a healthcare issue. One of the most important findings is that reaching the sustainable development goal of less than 70 deaths per 100,000 births is unlikely through healthcare spending alone. Structural factors like economic development and fertility patterns play a large role. Ultimately, this project demonstrates that data science can provide the clarity needed to rethink current strategies, and by combining predictive modeling with interpretability, we can better understand where risk exists and why. And by using this approach, it can help bridge that gap between reproductive health, economic resilience, and global health equity. And here are my references, and thank y'all.